This is me when I was pregnant working as a nurse. This was actually my last shift before I gave birth to my second baby. And I get a lot of women that message me saying, I'm pregnant, I'm a nurse. Like, are there any extra precautions I should take working as a nurse while pregnant? I thought for our tip of the week, we could cover some things that we should or shouldn't be doing when we are pregnant working as a nurse. And just a little disclaimer, we all know this, talk with your provider if you have any questions. This is just for reference information. It always kind of bothered me when I was pregnant working as a nurse and people would be like, should you really be working as a nurse while pregnant? It's like, hello, I'm pregnant, I'm not disabled. But you are growing a child, so there are things we need to be careful of and look out for. I will say most areas of nursing are still totally fine to work in as long as you're using the necessary precautions. And whenever you're in doubt of something, always ask. First thing I recommend doing when you're pregnant is telling your charge or manager or whoever it is, so that way they can be giving you appropriate patient assignments. Probably best for you to not have the patient that's in 4-point locked restraints because they're super violent when you're like super pregnant. Here are some other things you should consider. Radiation exposure. We consider this even when we're not pregnant, right? We step out of the room, we wear the protective gear. Standing and walking for long periods of time. Okay, so like we're used to standing and walking for long periods of time. So you can, as long as you're having a healthy pregnancy, should theoretically be able to still do these things. Now they can get a little more difficult, but make sure you're staying hydrated and you're still eating. It's hard because we're taking care of other people and we can neglect ourselves, but truly it's not just about you anymore, it's about your baby too. So make sure you're taking those necessary breaks when you need them. The other thing is if you work with chemo or medications that are super hazardous, we should be wearing the appropriate protective equipment. There are some infections you need to look out for in patients that you do not want to be exposed to, and these are things like C. diff, TB, flu, CMV. However, I will say some of these can be hard to just not ever be exposed to because we work in healthcare. So like if it's flu season, make sure you're for sure wearing your PPE. And if you're kind of questioning whether a patient may or may not have something, just err on the side of, caution and just wear your mask and stuff. The other things on here are the physicality of working as a nurse. Yes, we need to use proper body mechanics. I actually had a belly band that I used to kind of lift my belly up, and it helped save my back because my back was so sore by the ends of the day when I was working as a nurse while pregnant. There's also the increased risk of varicose veins. Wear your compression socks, we know, right? And then working with potentially violent patients, like I said, probably not best for you to have like the super violent patient if there's risk of you potentially getting kicked, hit, etc. Otherwise, just because you're pregnant doesn't mean you can't work unless there's some other precaution that your provider has told you about. It's pretty much safe to do so as long as we're just being extra mindful.